Hi, it's Dr. David Greene, CEO of the Arizona Pain Network. Today's topic is facet injections. What are they? How do they work? Well, let's start with what are they. A facet injection, also called a facet joint injection or facet block, is an injection that's placed into one's facet joints. Now, this is a lower back, a spine. This is the pelvis and the sacrum. So at every level on both sides, you have what are called facet joints. And that's where one vertebral level lines up with the next, and all of them together allow us an incredible range of motion of our spines. But they're joints just like your hip or your knee, and they contain cartilage, so they can become arthritic and hence painful over time. Now, they're not that big. They're about the size of a thumbnail, so a lot of times multiple of them can be involved, and a facet injection works just like any other injection with steroid medication and some numbing medicine into the arthritic joint to provide pain relief. Okay? So what are the indications? Well, arthritis is pretty much the #1 medical condition as we age that can cause chronic pain. Or it can cause pain that waxes and wanes and waxes and wanes. So what you can do is a pain management physician can look at x-rays, they can look at any other imaging studies, do a physical exam, and try and get an idea of the levels where the pain is hurting, but they don't always match up. An x-ray doesn't always tell the story, or a CAT scan or whatever. So a facet block can serve two purposes. It can help with pain relief. It can also be, quote, diagnostic. It can help tell the pain doctor, okay, this level or that level is the culprit. Okay? So how is the procedure performed? It's an outpatient procedure. It's very quick, and it doesn't take too much as far as the needle goes, because look at this. Here's where the joints are. They don't go close to the spinal cord or the dura, okay, or even a nerve root for that matter. Basically, it's going into this joint. So they do use fluoroscopic guidance, which is a real-time x-ray. And then once the needle is in place, they may inject a little dye to make sure it's accurate. And then that's when the steroid medication and the lidocaine, or the numbing medicine, is injected. And pain relief should be very quick because the numbing medicine works within 5 minutes. So then once the procedure is completed, your vitals will be checked for a little bit. You should be able to go home within an hour, all right? And should be back at activities within 24 or 48 hours. Okay, what are the outcomes? The outcomes are actually very good. It may take steroid a couple days to kick in, but once they do, a lot of times the back pain relief is immense. Most patients get at least 50%, some get 75%, or even full pain relief for weeks to months at a time. The average pain relief is anywhere between 8 and 12 weeks. And then after a few months, you can get the procedure performed again, to try and avoid the need for surgery. What are the risks involved with the procedure? They're very, very low. There's always a risk of infection. There's a risk of some bleeding. There's a risk of nerve injury. However, keep in mind, the nerve roots are farther in, and the spinal cord is underneath the bone. So you're basically just going into the joint on the back side of the spine. So that risk is really, really low. Okay, they also could have an allergic reaction to some of the medication, the standard things that happen with an injection. All right, there you have it. It's a very good procedure. So visit us online today at ArizonaPainNetwork.com. Our network of doctors offers medication management, interventional procedures. There's over 25 of them that they offer. Everything's customized to you or your loved one's needs.